chose me. She get down on her knees and hug me. Oh, she loved me.
September, big month, the beginning of fall. It's the end of the monsoon season, or so they say. And most importantly, September is the Prostate Cancer Awareness Month. And as it's designated, we want to make you aware by talking about the awareness of one of our friends, Phil Hammond, joined by Dr. Larry Bands of Prostate Solutions of Arizona. Phil, a part of the AZTV family, is the head of the engineering department here, but here we're talking about your own personal engineering. So talk to us about prostate cancer awareness, how you became aware that you had it.
Well, basically, there's PSA levels that were taken through the course of my life by my primary care physician. And at some point, that level started climbing a little bit. And enough so that my primary care said, let's start watching this a little bit more than once a year. And so we started taking readings every 3 months, and there was an increase in the levels every 3-month period, which is when I met Dr. Bands here, and we talked about having a biopsy. And at that point, did a biopsy where they took samples of the prostate, and a bunch of cores came up positive, so that one side of my prostate was showing signs of cancer.
Shocker.
Yeah, a little bit.
Dr. Bands, what about the PSA screening? Is that the answer to it all?
Well, it's not the total answer, and it's controversial these days. The government has actually downgraded PSA screening and the PSA blood test. And part of my job is to try to educate the public and primary care doctors that there's still a role for PSA. It should be utilized, in my opinion, for watching men like Phil and other people to look for potential early signs of prostate cancer.
Well, what alternatives do the Phils and the Pats have when it comes to further testing?
Well, really, it's just boiling down to PSA blood testing and a physical exam called the DRE, the digital rectal exam.
That's the one with the little rubber finger.
That's it, yes. And the other issue today is whether or not we should be scanning prostates with modalities like MRIs, or medical resonance MRI scanning. And the problem is cost. The insurance industry does not want to pay for MRI scanning of the prostate. So that's one of the dilemmas.
What about if the patient says, wait a minute, hold it. I want to find out if I have this, and if my doctor says I need an MRI, then I need an MRI.
Well, sometimes they'll pay for it. Sometimes the patient will pay for it. But the insurance industry in this country, ironically, is against MRI screening for prostate cancer. And ironically, in England, which is a socialized medical system, they're paying for it. So it's kind of a dichotomy here.
How does Dr. Bands feel?
I feel that we ought to be doing the easy things first, the PSA, the digital rectal exam, and I think if there's any abnormalities, I think a urologist should assess the situation, speak with the patient about options, and let the patient decide with informed consent what they want to do.
That's how Dr. Bands feels. How do you feel?
I agree with that, and
But I mean, how do you feel?
yeah, how do I feel?
You?
I'm doing well. I'm 42 out of 44 treatments at this point in time. I have 2 left as of today, and I've been able to work. I've played golf the whole time. I have very little side effects. For me, hardly any at all.
Did the doctor or any of his associates give you any advice when it comes to preventing reoccurrence?
I think we've talked about that, but at this point, it's a 90% cure rate with the treatment I'm doing, so I'm trying to remain positive, and I'll worry about that bridge when I come to it. But that's just how I operate. I predict I'm going to be cured, so, and I feel very confident with the way things are going that that's going to be 100%.
Well, you're optimistic about keeping AZTV on the air 7 days a week, 24 hours a day, and we hope that that optimism certainly pays off for you and your good health. By the way, when it comes to prostate, the minute you said the digital rectal test, automatically 74% of the men in the audience began to back away from the television station or from the television screen. Is that one of the biggest problems, getting people to come in for an examination?
Well, it's a difficult question for me to answer because I see them when they're already there.
But you've also been there yourself.
Yeah,
You've
sure,
been a patient.
Sure, I've been diagnosed with prostate cancer. I've been treated. It's really not. It's nothing, in my opinion. It's something that people are concerned about if they've never had a rectal exam for prostate cancer. But Phil can answer the question just as well as I can. It's a 20-second, 10-second test that's minimal.
Well, Phil's smile already answered the question.
Yeah.
And considering the fact that he's well on his way to perfect health, he's appreciative to you, and so are we. We're dropping by.
Thank you.
This program on this station that you keep on the air, Arizona Daily Mix.